Before celebrating the heart-protective power of salmon and other omega-3 rich fish, it is essential to acknowledge a hidden risk that many seafood lovers are unaware of: scombroid poisoning. This foodborne illness is surprisingly common worldwide, yet often mistaken for an allergic reaction or spoiled food intolerance. It occurs when fish such as tuna, mackerel, mahi-mahi, sardines, anchovies, or bluefish are not properly refrigerated after being caught. Bacteria naturally present in the fish begin to convert histidine, a naturally occurring amino acid in dark meat fish, into histamine. Because histamine is heat-stable, cooking, grilling, frying, or smoking does not destroy it. Once histamine levels rise beyond safety thresholds, eating the fish can trigger sudden and alarming symptoms, including facial flushing, burning or tingling around the mouth, throbbing headaches, hives or rash, heart palpitations, dizziness, abdominal cramping, nausea, vomiting, and diarrhea. In severe cases, blood pressure may drop sharply and breathing difficulties may occur, requiring urgent medical care. These reactions often appear within minutes to 2 hours after eating affected fish, and because they resemble allergic responses, many doctors misdiagnose the condition or overlook seafood handling practices as the cause. Scombroid poisoning is not a problem of seafood being rotten in the usual sense. The fish may look, smell, and taste normal, yet contain dangerous levels of histamine. The toxin forms specifically when fish are not chilled to near-freezing temperatures immediately after harvest. Even short periods of warmth during transport, storage, or improper thawing can accelerate bacterial growth and histamine formation. Many cases occur in restaurants, buffet settings, or home freezers where the cold chain is inconsistent. People with asthma, heart conditions, or histamine sensitivity can experience stronger reactions, and children and elderly individuals may struggle more with complications. Although most mild cases resolve within 24 hours with antihistamines and hydration, the sudden intensity of symptoms can be frightening and disruptive, and ignoring them can allow more severe reactions to progress. Because histamine contamination cannot be detected by visual inspection or cooking, prevention depends entirely on correct handling, storage temperature control, and choosing suppliers that follow strict safety standards. Yet despite these important warnings, fish remains one of the most beneficial foods available for supporting cardiovascular health and long-term wellness. Salmon, mackerel, sardines, trout, and herring are exceptionally rich in EPA and DHA, omega-3 fatty acids scientifically proven to lower triglyceride levels, reduce inflammation inside blood vessels, improve arterial flexibility, decrease clot formation, and support healthy heart rhythm. These nutrients help protect against heart disease, stroke, and sudden cardiac death, conditions that are among the leading causes of mortality globally. Omega-3s are so effective that cardiologists frequently recommend 2 or more servings of fatty fish per week as part of preventive treatment for hypertension, metabolic syndrome, and high cholesterol. Populations that consume seafood regularly, such as in Japan and Mediterranean coastal communities, consistently show lower cardiovascular mortality and longer life expectancy, demonstrating real-world benefits beyond clinical trials. The cardiovascular advantages extend beyond omega-3 fats. Fish provides high-quality protein without excess saturated fat, making it a leaner choice than many red or processed meats, which can contribute to inflammation and arterial plaque. It offers anti-inflammatory micronutrients, including vitamin D, selenium, potassium, and B vitamins, which work together to reduce oxidative stress and support strong immune and metabolic function. Eating fish in place of high-fat meats can significantly improve lipid profiles and blood pressure, while promoting sustained energy and healthy weight management, a combination critical for preventing heart disease. Salmon in particular contains astaxanthin, a potent antioxidant that protects blood vessels from oxidative damage and may further reduce the progression of atherosclerosis. To enjoy these cardiovascular benefits safely, understanding proper handling and storage practices is essential. Fish should be refrigerated at 4 degrees Celsius 40 degrees Fahrenheit or below and ideally kept on ice so that the temperature remains consistently cold from ocean to kitchen. Frozen fish should be thawed in the refrigerator or under cold running water, never at room temperature, on countertops, or in warm environments. Once purchased, fish should be cooked within 1 to 2 days or kept frozen for longer storage. When dining out, It is reasonable to ask how seafood is sourced and handled, particularly at buffets or places that display fish unrefrigerated. If fish tastes unusually peppery, metallic, or spicy without seasoning, it may signal histamine development, and the safest response is not to continue eating it. Recognizing the symptoms of scombroid poisoning quickly is equally important. Sudden flushing, pounding headache, intense stomach distress, itching or rash, and rapid or irregular heartbeat warrant stopping consumption immediately and considering medical care, especially if breathing difficulty or faintness appears. When properly handled, fish is among the most powerful foods for strengthening heart health, enhancing longevity, and enriching nutritional balance. Awareness of scombroid poisoning should not discourage seafood consumption but instead empower consumers to enjoy fish responsibly and confidently. By choosing reliable suppliers, maintaining strict refrigeration, and paying attention to early warning signs, we can protect ourselves from preventable illness while continuing to benefit from one of nature's most valuable and restorative foods. The message is simple: respect safety, guard against hidden risks, and embrace fish as a cornerstone of a heart-strong, health-focused diet.